Hey everybody, it's Jim from the Senior Social Squad. This video is the third of a series of my journey through prostate cancer. And again, I'm doing these videos because I'm hoping to, if you're going through this, kind of seeing what somebody else is going through will kind of help you along the way, and also to give you some information. As I do talk about information though, I want to stress, I'm not a doctor, I'm just a guy going through this, and I'm trying to learn a lot about it and pass it on as much as I can. But trust your doctor, do not trust guys like me on YouTube when it comes to making serious health decisions. All right, got that out of the way. So where we are today is 6 weeks from the day of my MRI. I had my MRI, got the results the same day, at least sent to me via email. Now 6 weeks later, I'm sitting down in the urologist's office and we're talking about the results of the biopsy that I had. In order to discuss the results of the biopsy, we have to talk about something called the Gleason score. It's really the centerpiece of a lot of the diagnosis and treatment decisions for prostate cancer. The Gleason score is a score assigned by a pathologist who looks at the tissue samples that were taken in the biopsy.
Germs under a powerful microscope.
And the Gleason score is on a scale of 1 to 10. And we really aren't concerned about 1 through 5 because that's non-cancerous. We get up to 6 and it's cancer, and then up to 10 being the most serious level of prostate cancer. It's also important to know, and I'm showing the results of my scores so you kind of get a picture of something to relate to as I'm talking about this. It's also important to look at a couple other factors, and that is the breakdown of the Gleason score, which is really broken down into 2 parts, 5 points for each part. The pathologist is looking for the level of advancement and seriousness of the cancer cells and grading them accordingly. And so I had a Gleason score of 7. But within that 7, most of my cells that the pathologist found were rated 3 out of 5, which is intermediate. And a minority of the cells, but some were present, were rated as 4s. It's good in the sense that most of my cells were rated 3s, but the ones who were rated 4 make it a little bit more problematic. And that's how I ended up at the score of 7. You'd rather have a 3 plus 4 than a 4 plus 3, because that would mean the worst cells are outnumbering the cells that aren't so bad. One of my tumors out of the 4 had a 3 plus 3 score. The other ones had a 3 plus 4 score. The other thing you want to look at in that report is where the tumors were located. My tumors were located on both sides of the prostate, which makes it a little bit more dicey in terms of treatment. The third thing on that report I'd like to point out is what they call percentage involvement. And that's kind of a complex term. And what it really means is basically the level of involvement of the cancer cells versus healthy cells. Once you get over 50%, that's troublesome. And a couple of mine were right up at that 50% level. A couple were a little bit lower than that. The urologist tells me that my cancer it's called adenocarcinoma, and that's a very common prostate cancer type. It's by far the majority of prostate cancers. So what the urologist did at this point, now that we've discussed the results, is kind of painted over the treatment options with a real broad brush, because at this point he's referring me to an oncologist, a specialist in prostate cancer. So that's where I'll be going from here on in. But he did say basically there's really 3 options, but there's lots of choices within those options too. You can wait and see, and a lot of men end up doing that. The second option is radiation, and that's non-invasive, but there is some chance for side effects, and radiation's going into your body, and you can damage the bladder, possibly. You can damage the nerves leading into the penis and cause problems there. So there are some side effects from radiation to be aware of. So it's not to be taken lightly. And the third option is the most serious option, and that be removal of the prostate gland. I'll be going to see the oncologist next week, and we'll be deciding on treatment options and moving forward from there. Hope you're getting something out of this video. I will see you after my meeting with the oncologist.